This is Focus with Jack Connell.
Hi everyone, I'm Aaron Dickens. Thank you so much for joining us for this month's edition of Focus. And today we're talking about a very important topic, cancer. It affects many of our loved ones, family, and friends. And February is actually National Cancer Prevention Month. And I want to read you guys some stats right now. The American Cancer Society estimates there will be 1.9 million new cancer cases in 2021. And more than 600,000 deaths this year. Now, that is more than COVID-19. COVID-19, we've had over 400,000, so that is significant. That same study estimates 5,000 of those new cases will be here in South Dakota, and this is really interesting. The study says over 40% of those cases are potentially preventable. So we have a lot to talk about today, and we are here with Dr. Mark Hancock, a cancer care specialist from Monument Health. Thank you so much for being here with us, an important topic.
My pleasure.
Tell us a little bit about yourself.
I'm a medical oncologist, hematologist, and I started here in Rapid City last March. And about 2 weeks after I got here, COVID arrived. We started having a couple of cases among the staff in March, and everything since then has just been different. It's a very new world, so it's an interesting way to start tenure in a new spot. But before I came here, I practiced in Colorado for about 20 years, and I had a private practice there for a while. I worked at the university for a while, and I worked on the Western Slope in Grand Junction also for a while. And we were looking for kind of a new place, and this Rapid City opportunity came up. We checked it out, and we liked it. So I'm here now, and I do general oncology, community oncology, mostly solid tumors of various kinds. And that's it. I'm originally from Texas, West Texas. I trained in Texas at Southwestern Medical School. Trained at Parkland Hospital as well. Did my specialty there. I worked overseas for a while with Doctors Without Borders. Sort of while I was doing my training, I took a little time off and did that. So that's it. I got a family. Most of my kids are either in college or out of college and working.
Okay.
So they're all doing well so far.
That's great. And, in terms of cancer, what are the most common cases that you see of cancer?
Well, the most common cases that we all see are what we call the big four, and that would be breast cancer, lung cancer, colon cancer, and prostate cancer, just because they're the most common. And then, after that, other gastrointestinal malignancies, bladder cancer, kidney cancer, and a smattering of other things. There's a lot of hematologic sort of blood cancers, like different kinds of leukemias and lymphomas and myeloma. So kind of a panoply across the spectrum, all kinds of cases from early stage to late stage in young people and old people. Basically anybody over 18, otherwise they fall into the pediatric oncology category, and that's treated a little differently.
And I thought it was interesting that over 40% is potentially preventable. Do you agree with that, or what is your opinion on that?
For cancer?
The cases, yeah.
Certainly there are ways to mitigate your risk of cancer. Diet and fitness are very important in cancer prevention. Not smoking, obviously, mitigating your alcohol intake, sun exposure for melanoma. But fitness is something we could do a lot better there across the board in cancer prevention. There's also cancer screening, and an intervention like colonoscopy is very good at both screening and prevention, because with colonoscopy you find lesions like polyps that have not yet turned into cancer,
right,
and those can be removed.
Right.
And so it's really a screening tool that also qualifies as a preventative technique. And we don't do very well with getting colonoscopy done in as many people as we should. It's probably at about 50% of the patients who would qualify for a colonoscopy actually get one.
Wow.
And there's some new techniques, stool studies and different kinds of CT imaging that can be done in place of a colonoscopy, but colonoscopy remains the gold standard just because in the combination of screening, looking at the bowel, checking it out in its entirety, and also being able to remove the polyps and do biopsies at the time of the procedure, which none of those other studies can yet do as reliably.
How old should you be to get, started with screening?
Well, for colonoscopy, at age 50, generally across the board, if you've had an affected relative, especially a first-degree relative, then 10 years before whenever they got colon cancer. So if you have a relative who got colon cancer at age 45, like your father, then you should start out at age 35. And if you have more cancer in your family, say you've had a mother with breast cancer, or a father with colon cancer, or prostate cancer or something, then you can consider getting some genetic counseling and find out if you're at risk or have some kind of hereditary syndrome that might indicate you need additional screening and evaluation earlier, other interventions that might be applicable.
I wanted to talk a little bit about exercise. A lot of people, in their 20s, 30s, even 40s, will say, oh, maybe I'll exercise later on, and they'll put it off, right? Does even getting out and walking a little bit every day or doing some kind of exercise, will that help you in the long term in preventing cancer?
It seems to. Even a little bit of exercise and activity is better than none, obviously. Right. And, as far as the type and intensity of exercise, the data is less clear.
Okay.
But moderate exercise is probably the best bang for your buck as far as the return you get. So some people recommend 2.5 hours per week of moderate exercise, 30 minutes, 5 days a week of sustained activity that where you're breathing, you can maybe talk in short sentences, but you couldn't sing, at that moderate level of exercise.
And guys, there's about 160 hours in the week, so 2 hours a week, that's not too bad, right?
2.5, yes, right. Something like that. It's different for everybody, and try to find your sweet spot, what works for you. But it definitely a goal that would provide benefits across the board, not only just in cancer, but in diabetes and high blood pressure, other cardiovascular complications, just a general sense of well-being, psychiatric benefits. It's as far as just across the board health improvement, exercise and diet can really add some benefits.
What is your passion? What drives you to help people with cancer? What do you get from it personally?
Well, intellectually, it's challenging. It's very rewarding taking care of these people. I've enjoyed it from the very beginning. When I was a fellow or when I was a resident, I did my rotations in all the different specialties, and I connected with oncology then, doing some research with one particular professor who was my mentor at the time, and some new molecular technologies and diagnosis and treatment were just starting to come to the fore. When I was a resident, almost all chemotherapy was given intravenously, had to be done in the hospital because it was so toxic, and by the time I finished my fellowship, almost all our treatments were then done outpatient because we had new drugs to control nausea and keep blood counts from falling, and new chemotherapy agents that were more effective and less toxic. So I've seen a sea change in how we manage cancer and what the face of oncology and cancer care look like since I've been in practice for these 25 plus years. That's been very rewarding.
Yeah, and do you see a lot of people overcome the disease, or what is your experience like?
Certainly. There are patients who come in that pretty much from the get-go they're going to have a tougher go of it, and getting a cure may be less likely, but over the long run your practice tends to fill up with the patients who've done well. Yeah. And there's some very grateful people in that crowd. So it's quite a rewarding day for the most part, with the challenges scattered.
Well, that's awesome. Well, guys, we are going to have more with Dr. Hancock, and we're going to talk about specifically more with cancer and COVID-19 as well. So stick around. We will be right back after the break. Welcome back, everyone, to Focus, this month's edition of Focus, and we're talking about cancer. February is National Cancer Prevention Month. And, you know, some celebrities recently have died of cancer recently. Dustin Diamond, I don't know if you guys watched Saved by the Bell, he was 44 years old. He just died of cancer recently, of small cell lung cancer. It was a very aggressive disease, and he reportedly was just diagnosed with it like a couple weeks before he died. You know, it's just, you know, I'm in my late 30s and I'm seeing someone, a celebrity like that dying 44. Are you seeing more younger people now getting cancer, or what's your take on that?
In some cancers, there's been a trend towards younger populations. Colorectal cancer is one where we've seen some of that. It still remains a disease that's more common the older you get, but that varies across different tumor types. Changes that have occurred, you know, so as far as demographic shifts to younger folks, have sometimes a viral cause. I mean, there were HIV-related cancers that were sort of exploded when I was in training and now very much disappeared. I mean, we don't see them as much. But there's some like HPV-related, is a human papilloma virus, and so for head and neck cancers and cervical cancers and some others, those, you know, those can affect the younger population more, and we have seen more of those over the past couple of decades, maybe.
Yeah, and you know, I just moved here a couple months ago. You just came here in March when the COVID-19 pandemic was just starting.
Correct.
Talk about your experience with that, coming to Rapid City when everything was just, you know, coming out like that.
Well, I arrived, my first day here was March 1st last year, and you know, there was you heard about COVID sort of in the background, and we didn't think it was going to hit us in South Dakota maybe, but we had the first case in the city, I think, in our cancer center among one of the staff and then another staff. And it really wasn't even in the community yet, so it was really related to some travel, but we had to shut the place down and we cleaned it all. You really didn't know what to make of it at that point in time, but we went to remote visits, which was new. I mean, it's never been done. It didn't seem practical in oncology patients, but we made it work, and for the most part, I think, got away with it. Then after we started to get comfortable with what COVID was, and we started seeing patients in the clinic again, primarily due to patient demand. I mean, the patients really weren't comfortable not ever seeing their oncologist in person and just doing video visits or televisits. You know, you can't do a physical exam, and we started seeing patients in the clinic, and there were things we were missing, you know, things you can pick up on exam, and also that face-to-face interaction, you know, in person, especially in the setting of oncology, cancer care. You know, it adds it's a whole different dimension, you know, if you don't have that.
But I think the hospitals here are doing a lot better than other states, especially California. You know, when you can't even get a bed, if there, you know, there's a line of ambulances waiting outside to get a bed in California, and here that's just not the case.
Well, we've been fortunate that way. I think, you know, initially we ramped up and looked at what our capabilities were and assessed our reserves, and there were definitely some holes that we needed to fill in. You know, we wanted to make sure we had capacity within the hospital and within the cancer clinic to take care of what might happen, and we didn't really know what was coming. But for a long time, nothing happened. You know, it was raging elsewhere, and South Dakota was very quiet, and then we kind of got a late wave. But even at its worst, you know, we were able to maintain, you know, the ability to care for the people who needed to be cared for, and we didn't really run into capacity issues. I mean, it was busy. It was full at its peak. And it's become much more manageable, and we've been on a downward trend now for a while. And South Dakota is, you know, one of the leading states in vaccination. So that's helped as well. As more people get vaccinated, you know, it's going to add to that already building herd immunity, and the virus is just going to have more trouble spreading. I mean, I've heard estimates now that we're 30 to 60% herd immunity levels now. And that could be very encouraging.
Now, if you have cancer or your family history of cancer, are you more susceptible to COVID-19, or do we not know that as of yet?
So every cancer is different.
Okay.
Some cancers, especially some of the hematologic malignancies, may have more of an immunosuppression component to them because they involve the cells that are responsible for mounting your immune response. And so that may increase your susceptibility a little bit. We don't have all the data.
Right.
And most of the questions, I think for most part, cancer patients are just as susceptible as anyone else to getting it, but they're more susceptible to the complications, severe complications and death, related to those complications. And so, we urge our patients to be careful and, take the precautions that are recommended. And we were happy last week or the week before to start being able to offer the vaccine to more of our patients generally. And the demand has been high, as you can imagine. Crashed our phone system the first day we opened up for appointments. Trying to get as many vaccinated as possible. The timing questions have been, about the timing of when to do the vaccine if they're on active treatment.
Right.
We don't know the best time. The main thing is to get the vaccine.
Yeah.
Our national society, ASCO, has recommended maybe in between treatments if you can. But
So even if you're undergoing cancer treatment, you should still get the vaccine?
yes.
Oh, okay.
Yeah, and unless there's, some patients who've had bone marrow transplant really have had their immune system wiped out, there may be some special considerations, and of course you consult with your physician and healthcare team in that setting. But for the overwhelming majority, we think it's fine to go ahead and get the vaccine. We recommend it. You may not respond as well.
Right.
I mean, as the immune system is affected by a lot of cancer treatments and steroids and things that we use pretty liberally, that may blunt the response to the vaccine. We don't have any evidence that that's the case yet, but it's better to have some response in any case than none.
And when do you think that the general population will be able to get the vaccine in South Dakota? Do you have any idea? No?
That's above my level.
Okay. And do you think it's important to get the routine cancer checkups even though this pandemic is going on? Is that important?
Right. That's been a challenge. I mean, especially initially, we weren't sure, if we could keep some of those basic services open.
Right.
Site like mammography and I think that a lot of routine assessments were delayed, and our concern was that things that should be addressed were not getting addressed in a timely fashion, and so we expected there to be some catch up, at the end. And I think that people are in now and getting a lot of those services, but it's still not fully up and running, and there's a lot of precautions still underway, and if you've been exposed, maybe you can't go in, and so it's more difficult now than it was a year or 2 years ago, but it's better.
Okay, well, that's great. Well, thank you so much for being here with us.
You're
It was a
welcome.
pleasure. We learned a lot today, and we are going to speak to a cancer survivor right after the break, so stick around. Thank you so much, and we'll be right back. Welcome back, everyone. We're talking about cancer this month. February is Cancer Prevention. And we are here with Jess Holland. You are a cancer survivor. Thank you so much for being here with us, telling your story. Tell us a little bit about your journey.
Well, I initially came from Texas, work-wise, and ended up going from Wyoming, to Wyoming, and then after that I transferred over here to Rapid City. Within about a year, I found out I was diagnosed with lymph node and tongue cancer, and got involved with Dr. P. Wright and Dr. Hancock here at the Cancer Care Institute, and did a bunch of preliminary, just talking, kind of going through the motions. They were very thorough with what the next step would be. And then within a few weeks, I was set up for radiation treatment and chemotherapy treatment.
And how long did you have to go through that for?
My initial diagnosis was a 5 to 7 week period.
Okay. And how were you able to were you able to overcome it, or?
I actually was. It was very tough. I won't lie to you. I didn't realize till getting through the first parts of the radiation, the first 2-3 weeks was okay, and then within a certain period of time, I lost all taste, which was, I was told prior to that that was going to happen, and that at some point, once I was completed, or had completed, excuse me, with the radiation and the chemotherapy treatment, that my taste would come back. There was no set date, no set time. They just said that each time, once you're completed, you will start to notice a small change. It'll get bigger, it'll get, from there. And then I just kind of went through each treatment, just trying to make it through the day, to be quite honest.
What inspired you to keep going, to keep powering through it?
Well, family, and I have a 20-year-old daughter who is in college back in Texas, and I just had a lot of family support. Again, the local doctors here, the staff, even the front desk personnel, all the nurses. I mean, I can't even tell you how amazing, how incredible each nurse, and just the staff. I mean, they didn't treat me like a number from the very beginning. They really got to know me personally, asked me about my background, which was military, and then from there I just decided to have some sort of focus on what I needed to do, each individual treatment, because my treatment usually would last anywhere from 10 to 15 minutes when I did the radiation, and then when I went over to Dr. Hancock's side to do the chemotherapy treatment, that was anywhere from 2.5 to 3.5 hours.
Wow. There's a lot of people going through cancer right now. What advice do you have for them when they're going through a tough day?
My biggest advice is to try to stay focused on set yourself some goals.
Yeah.
My biggest goal was learning how to, I got to a point where I wasn't eating as much, and I had a feeding tube planted in me along with a port to help me out with different things. But the main thing is to set some personal goals for yourself, stay focused on your family, know that there is an end in sight. And again, as earlier, as Dr. Hancock had previously stated, is that everybody's cancer is different. Mine personally was curable and in a recovery stage, and now I just focus every day with just setting high goals and just making sure I know exactly what I want to do.
What have you learned through this experience? What do you think, have you learned not to take life for granted, or what have you learned, do you think?
I've learned that people that develop the different stages of cancer, I always looked at it, people you'd always say, oh, well, it'll never be me.
Right.
Well, you have to take care of your health, as Dr. Hancock stated, exercise. I got to where there were certain points that I didn't want to walk.
Yeah.
I didn't want to get out and do anything. And I had family members say, look, just walk to the end of the block.
Exactly.
You got to have a starting point.
Absolutely.
And then I got to where I was trying to get back into a small weight routine with like 10, 15 pounds. I didn't realize how much it affected my overall physicality and what my muscles would do. Of course, we all know that muscles have memory, but at the same time, I wasn't sure exactly at that point what mine was.
And you're exercising now?
Yes, sir.
Okay. Great.
So I continue to make sure that I do small weights. Now I walk, anywhere from 2 to 3 miles. I just try to get lots of exercise and get out. Sometimes just walking in the grocery store or walking wherever you may want to walk really helps. And just staying hydrated is one of the biggest things. And you just push through it.
Yeah.
And you find your family, you lean on your family. They are the key people, and along with your doctors. If you ever have any questions or concerns, I had one specific nurse that was assigned to me, and she's like, if you ever need me, text me, call me, whatever you need. And it's just, I don't feel 100% better.
Yeah.
But I'm probably about 75, and that's a lot more than I really was in the beginning.
Congratulations.
Thank you.
And thank you guys for joining us, and we will see you soon. Thank you for joining Focus. Take care.